Okay, welcome back. Today we're going to be counting the rib cage and we're going to be identifying each rib, starting up at rib 1 and working our way down all the way down to rib 12. Okay, one of the first things I want to note is that when you're looking at a skeleton, you're looking at a model of desiccated or dehydrated dried bone. So the bone is a lot thinner as modeled here than you would see in a live person. So that's going to impact the spacing as well between the bones. Okay? The first thing we're going to do is find the clavicle here, and then once we found the clavicle, directly below the clavicle will be rib 1. If you go out laterally, it might be difficult to palpate rib 1 because it goes underneath the clavicle. So the best place to palpate it is here at the attachment to the manubrium. Once we found rib 1, we can then walk our fingers down and find rib 2. Rib 2 is very easy to locate because it's always attached right at the sternal notch, and you can locate rib 2 by locating the sternal notch, and that is the joint in between the manubrium and the sternal body. Once we found rib 2, we can walk our fingers down and find rib 3. Note that I'm staying close to the sternum here at the attachment points. Once we found rib 3, which is also a fairly easy rib to find, we can then walk our fingers down and find rib 4. Rib 4 generally you will find on many people will be depressed or tucked in, but you can find it right here. Over here there might be breast tissue, etc., so I recommend locating rib 4 here close to the sternum. From here, we can walk our fingers down and find rib 5. Again, rib 5 might be depressed and fairly tucked in, but you can find it right here. Once we're here, we're going to note that ribs 6 through 10 have a common attachment, and it gets very confusing to try to figure out which one's rib 6 and which one's rib 7 in here. So what I would recommend is once you found rib 5, slide your fingers out laterally and then work your way down into rib 6. Rib 6 has a particular feel to it and some distinguishing characteristics. The more you palpate it, the more you'll be able to recognize right off the bat that you're on rib 6. But it has typically a little bit of a flare or cup here on the lateral portion that would occur underneath the breast tissue or the chest. Once we found rib 6, and again, we're staying out lateral, we can walk our fingers down and find rib 7, walk our fingers down into rib 8, 9, and finally 10. So 10 is directly attached by cartilaginous tissue into the sternum, and it shares this common attachment. 11 is not. So once you found 10, you're going to make sure, and you're going to feel for this attachment here. When you drop your fingers down into 11, what you should feel is the point of the rib. Okay, so if you feel that point, you're pretty sure you're on 11, and then you can drop your fingers down a little bit more laterally, and you should be able to feel 12. Okay, so we are counting the ribs, and we're going to start from the clavicle and move our way down. Clavicle, of course, very easy to find. It's up top here. Right under the clavicle, you're going to find rib 1, and it's going to be slightly dipped in and slightly under the clavicle, especially as you follow the rib around, it's going to go below the clavicle. Here you'll be able to access especially the attachment point to the manubrium, which is the top of the sternum. So once I find 1, which is in here, and it's a little bit deep in here, I can slide down from there and start to find rib 2. Now again, rib 2 is going to have, or where it's going to be attached is right at the sternal notch, which is between the manubrium, the top of the sternum, and the body of the sternum. So you'll be able to come up here and feel this notch, and it's going to immediately allow you to orient to rib 2. So it's right there. And now I get a feel for rib 2. I can feel it's a little bit tucked into rib 3, which is below it. So I'm going to move my fingers now down to rib 3. And here I'm going to stay very close. Again, I'm going to stay very close to the sternum as I'm counting. On a woman, of course, is going to be breast tissue here, so you're going to avoid counting through the breast tissue. Okay, once I've found 3, I can go ahead and walk my fingers down to rib 4. Once you get down to rib 4, again, you're going to stay close to the sternum here and be counting at the attachment points, but things are going to get a little bit more confusing, especially 4, 5, 6, and 7. Here, rib 4 feels a little bit dipped into rib 5. But I can still feel the length of the rib here. So from rib 4, I'm going to walk my fingers down to rib 5. And it's a little bit depressed too. So rib 5, as it runs out, is going to come right under the nipple. And then from rib 5, I'm going to walk my fingers down to rib 6. Now, as I come down to rib 6, I'm going to be swinging out a little bit more laterally because, again, rib 6 shares a common attachment with ribs 7, 8, 9, and 10. So it's a lot easier to count it a little bit more laterally than it is towards the middle. So on a woman, what you're going to be doing is swinging under this breast tissue to accurately find rib 6. And then you're going to go ahead and you're going to follow rib 6 out just a little bit. And what you might notice, again, with rib 6 is a little bit of a greater width towards the lateral edge where it's almost like a little bit of a cup. And it'll have a really particular and distinguishable feel to it. I'd say rib 6 feels a little bit depressed in here, and that's normal, what you're going to feel with just about everybody. So from rib 6, and again I'm lateral here, I can now walk my fingers down and find rib 7. And from there, again, I can walk down and find rib 8, and then walk down, find rib 9, and then I can walk down and find rib 10. And once you find rib 10, you want to make sure that there's an attachment directly into the sternum with that common attachment, the cartilaginous attachment. And once you've confirmed that that attachment is there, drop your fingers down again, and you're going to find the point or the very end or tip of rib 11. And again, this rib, it might be very, very far up here, or it could be down here, depending on the person. But what's going to be the same with everybody is there won't be an attachment there. It's going to be a floating rib, and you'll be able to find that point. And once you found that point for rib 11, you can then swing below that and find the next point for the tip of rib 12. Okay, so coming up again and finding this ridge here, and this ridge here between the manubrium and the body of the sternum is where you're going to find rib 2. Above that, you'll find rib 1, possibly tucked underneath the clavicle and into rib 2. But once we find this notch here, we can orient ourselves off of rib 2. So below rib 2, we're going to find rib 3. Below that, we'll find rib 4 and rib 5, and then rib 6, and we're going to be moving away a little bit from this common attachment here, following rib 6 out. Below that, we can find rib 7, 8, 9, and 10. And 10 is going to have an attachment directly into this common attachment for the floating ribs up into the sternum. And below 10, however, 11, you're going to find the point of 11, and it's not going to be attached into there. Instead, it's just going to be free and floating, and you can find it right about here. And then below that, under that is rib 12, and that's a little difficult to locate from the interior.
Nice.
Hey everyone, thanks for checking out this video. If you'd like to see more, please support me on patreon.com.